Hi, I'm Kerri. I'm a physical therapist here at CORE, and I treat a lot of the women's health patients that we get. So I see anything from a pregnant person to somebody who's just had a baby to somebody who's having trouble with incontinence or pelvic pain. So, for instance, if I'm working with somebody who's pregnant in that stage of their life, then we're going to do some really gentle type of things. I can still use my manual therapy skills on somebody who's pregnant, but we're just going to be a little more careful. We're going to be careful of this baby in here. Take special care of that little package there. But we're also going to treat the hips, back, legs, anything we need to do depending on what kind of issue she's having. Postpartum, sometimes we get people who are having pain. Sometimes we get somebody who's got what's called a diastasis rectus, and that's just a separation of the abdominal muscles, of treating somebody for that around this time. And we're just working on some different core stability issues, but I'm also using my hands, my manual skills, to help move some of the tissues around here, get the fascia moving a little bit better so that those tissues can approximate and start to function better. So I'm also treating somebody or some people with pelvic pain issues, and that could be anything from pelvic pain in the abdomen to vaginal pain or pain with intercourse. And sometimes we have to do some internal evaluation for that, or treatment even. But quite often, something that we can do is do our regular manual therapy skills. Working the fascia and the viscera of the abdomen can help quite a bit. Working the fascia of the back and the mechanics of the back, and getting the nerves and everything to start working better in through the back can make a big difference in pelvic pain issues. The other thing that we treat a lot is incontinence, and that could be bladder or bowel incontinence, and there's lots of different techniques that we can use to help. Again, we're always looking at how to improve the tissue mobility and get those tissues to function better in this area. But then we talk about a lot of different exercises and techniques that you can use at home to try to retrain some of those muscles and the stuff around the bladder to help improve that function. So that's what we do.